Hello, my name is Sangvi, and I'm currently a student at University of California, Berkeley, studying molecular and cellular bio.
And my name is Nicole, and I'm currently a student at UCLA studying neuroscience. And today we'll be discussing neurology and its bridge between that and public health. So I'm sure we've all heard the study of medicine and public health, but have you ever actually pondered the difference between the two subject matters? They definitely fall under the same umbrella, but public health, as the name somewhat suggests, applies more so to philanthropy and community outreach in order to educate on the prevention of disease and injury from occurring in the future. Whereas medicine, on the other hand, focuses more on the treatment and diagnosis of such in that moment in time.
So now we're going to move on to public health workers, and this is just to provide some examples of what they might look like. So this would include health commissioners, directors, public health sanitarians, public health technicians or engineers, public health nurses, epidemiologists, public health educators, doctors, nutritionists, scientists, and finally dentists and dental hygienists. And so now we're going to be talking about healthcare disparities. So with publicity to such a wide range of people, it may seem easy to forget that healthcare is most definitely not accessible to everyone. We are going to discuss first racism. So racism is a system of structuring opportunity and assigning value based on the social interpretation of how ones look that unfairly disadvantages some people and communities and unfairly advantages other individuals and communities, which ends up sapping the strength of the whole society through a waste of human resources. So you might be wondering how racism is related to public health, but actually it's a huge factor in lifespan. The life expectancy of non-Hispanic and Black Americans is 4 years lower than that of white Americans, and the CDC has even addressed racism as a serious public health threat. A lot of the racism that we see in healthcare stems from centuries-old information and legislation, which now impacts access to healthcare and increased risk for poorer health outcomes. Additionally, issues such as redlining, which are laws that prevent POC from living in specific neighborhoods, have led to the loss of access to healthy foods and grocery stores. During the ongoing COVID-19 pandemic, we easily see the disproportionate impact among racial populations.
And then moving on to characteristics of other individuals, immigration status is also incredibly prevalent due to the lack of resources that allow these individuals or families to have insurance or affordable health care, and that also includes preventive care. Currently, the United States does not have any regulations that provide health protection for immigrants, and undocumented immigrants have even worse statistics. Moving on to socioeconomic status, that is an incredibly important stressor as well, because those who are unable to afford insurance or emergency hospital visits will not do so or hold off until the health issue at hand is pronounced or deathly. These individuals will not seek preventive care, and this affects health outcomes as well. And finally, moving on to female health, females experience more obstructions to proper treatment and care than males. We see this pronounced difference in reproductive care. A huge number of pregnant women are mistreated during delivery, which leads to death, excessive bleeding, paralysis, and much more. It is also known that physicians will often believe that females are delusional or overreacting in medical situations compared to their male counterparts, and can in turn lead to huge disparities in health outcomes as a whole.
So here, this graph shows how people of color are facing long-standing disparities in healthcare coverage, which is really important for the maintenance of public health. So overall, we can see that white and Asian American communities have lower uninsured rates over time in contrast to Black Americans. And again, this statistic is just important to understand how people of color have been facing public health issues for a long period of time.
Okay, and then with the world we live in today, it's also pretty difficult to precisely distinguish what will obscurely promote disease and infection after short-term and even longitudinal exposure. It's still being studied in our present day as well, since our climate is always changing. However, there has been a particular pattern within environmental and social components that we have picked up on. Generally, extreme weather events and abrupt changes in our climate create a chain of alterations to our external and internal well-being. Heat waves, floods, and storms correlate to high percentages of deaths depending on the geographical population and what people are and are not used to.
And this graph on the left is to show the loss of human life and money due to numerous types of natural disasters that have been exacerbated due to climate change. And we can see that from 2004 to 2013, $392 billion have been lost due to hurricanes, $78 billion have been lost to heat waves, $46 billion have been lost due to tornadoes, and $30 billion have been lost due to flooding. And we can also see over a 10-year period of time that the highest fatality rate is due to heat waves. And some other statistics include more than 5 million deaths every year are linked to abnormally cold or hot temperatures. And in 2021, a heat wave in Oregon and Washington resulted in 600 deaths within only a week. And from 2008 till now, 20 million people have been displaced due to natural disasters, and this greatly impacts mental health because of the trauma, loss, and anxiety caused. Extreme heat can also lead to excessive aggression and mood disorders, and climate change does not actually affect everyone equally. Those of low-income minority communities, elderly children, and homeless are just some examples of groups that are in more danger than others.
And then, according to the American Psychiatric Association, psychiatric medications can interfere with a person's ability to regulate heat and their awareness that their body temperature is rising, which is often associated with injury and death. Such heat waves also have been associated with mood disorders, anxiety disorders, dementia, and aggression-related disorders.
So now we're going to move on to impacts of climate change. Some important impacts of climate change include water and food shortage, which will lead to malnutrition and dehydration, ultimately important factors in neurological function. Additionally, climate change can increase migration and displacement due to environmental disasters. Migration and displacement is a huge stressor that can lead to psychological distress and increased risk of developing PTSD. And furthermore, economic and social stress can be caused by climate change because of increases in prices and produce during drought. In turn, this chain reaction negatively affects mental health and leads to an increased risk of depression, anxiety, and a multitude of other neurological disorders.
And then a lot of these effects are a result of chain reactions involving previous trauma and mental illness. And according to the National Center for Biotech Information, the delayed development of PTSD is associated with impairment in the overall quality of life and significant subjective distress, and the development of acute and transient psychosis and relapse of bipolar disorder, just to name a few of the possibilities. Additionally, as mentioned before, droughts are inevitably associated with crop failure and have exhibited a correlation with farmer suicide rates, possibly due to a difficulty in maintaining family expenses, as well as a rise in food and other goods in the region. This creates an inability of these families to make basic purchases and further leads to malnutrition and risk of other infections as well. So to wrap up a little bit and to finally bridge the gap between public health and neurology, the brain is such an incredible organ. And although we are most definitely far from knowing all about this phenomenal processing unit, neurology and its disorders are a branch of public health that is quite often overlooked, especially as the effects of recent events and emotions are still being observed every single day. Our brain is like a muscle, and like any other muscle in our body, it should be exercised and recovered properly in order to maintain its higher order functionality and overall health.
So finally, we're going to be covering some prevention methods for neurodegenerative diseases, which includes monitoring blood pressure and maintaining a healthy diet with exercise. It's important to avoid carcinogens such as smoking and alcohol. And additionally, if you have a family history of neurological disorders, it's important to attend your yearly preventative checkups with your physician and report any changes you notice in behavior immediately. Sometimes it is even beneficial to ask your peers or family to observe your behavior for changes. As said before, this is almost all like one big chain reaction. Routine checkups help monitor changes in blood pressure that are not physically visible, and to help control or lower high blood pressure, your doctor may suggest exercise and changes in your diet.
Okay, and then for our quiz, we compiled a quick Google form for you to complete, so you may receive credit for watching. And we discussed questions on medicine versus public health, disparities, and prevention methods.
And here are the answers to the questions. Thank you guys for listening, and you may now move on to the next lesson.